And our topic for this afternoon is going to be white line disease. You may have heard the word seedy toe, hollow foot, wall thrush, and even stall rot. And essentially all those are referring to white line disease, okay?
Absolutely.
Of course, when we think about wall thrush, you know, we know what thrush is, the thrush that affects either side of the frog. But when we say wall thrush, I think it gets the name simply because we have this bacterial problem underneath the hoof wall itself. When we say stall rot, what I come to see there is maybe someone that's not doing a good job in cleaning stalls, and we have a bacterial infection that started that particular way. However, though, with white line disease, you can have the cleanest barn in the world, have the best environmental conditions in the world, and still have white line disease. So no horse is singled out, essentially.
Absolutely.
It affects all horses, all breeds, all ages, you name it.
Okay? If you have a horse, then they're more likely to get this at some point in time.
That's right. And of course, the other term that was used was hollow foot. And believe it or not, what's going on is we have a problem underneath that hoof wall, and we have certain, we'll call them unfriendly guests that get underneath the hoof wall, and they like to digest, they like to eat what's underneath the hoof wall there. And if you actually took a hammer and kind of tapped the hoof wall, you can tell the difference in the sound, hence the name hollow foot. And then the last one was seedy toe. And there's some debate there as to whether or not seedy toe is actually white line disease. So this afternoon, I'll let you make that decision yourself. Of course, the hoof wall is involved, bacteria and fungi is involved, and so we'll let it go with that when we say seedy toe.
Absolutely.
All right.
Well, Mike, when we talk about, of course, white line disease, what all aspects of the hoof does the white line disease affect?
That's a good question, Corbin. In fact, when we talk about what part of the foot that's going to be affected, when we take a look at the hoof wall, and if we zoom into this area right here, and hopefully you can see this, basically everything from the end of my pen out is the hoof wall. In fact, the thicker part there is actually the hoof wall itself that it's kind of like your fingernail there, so to speak. But what's going to be infected is going to be what's underneath that hoof wall itself, this particular area here. So there's actually 3 layers to this area. And of course, there's the outer layer, there's the middle layer, and then there's the inner layer as well. And we can call the outer layer the stratum externum. The middle part we can call the stratum medium, and then the inner part we call the stratum intrum, if you want to get pretty technical about the situation. But with our presentation, we're just going to talk about the outer, the middle, and the inner wall as far as the layer itself. Now, the part of the wall that's affected is the middle part. And we might ask the question, well, why is only the middle part affected, not the outer and not the inner? Okay?
Okay.
And then the next question we might ask, well, what is it that's causing the problem? Well, we have a couple of companions that like to work together, hand in hand. One of them is bacteria, and then the other one is fungi. Okay? And for some reason, we can say that the bacteria might be the leader of the pack, because bacteria and fungi is ever present in the environment. Bacteria is searching for an opportunity to get inside the hoof capsule itself. And once it does that, it's going to set up shop, and then it gives an opportunity for fungi to come in and do its thing. So that's what the area that's affected is, the middle part there. And the reason that the outer part is not affected is, number one, it's much denser. It's much harder, and it's exposed to the oxygen. The thing that we haven't pointed out, and that we need to do this about the bacteria, that it's anaerobic, meaning that it thrives in the absence of oxygen. So there is oxygen in that outer layer there. There is no oxygen in the middle area, but there is oxygen in that inner layer simply because of the proximity to the live tissue that's present. So we have oxygen that's present, we have nutrients that's present there as well. So the middle part is what's being affected there. If you take a look at this slide here, and you take a look at this foot here, you see the areas, even back in the heel area, back in the toe area, where we've got this wall separation that started in this particular hoof capsule here. And this is some of the early stages that we're going to see when we talk about having a white line problem. This is visible. Sometimes white line we don't see this way until we end up with a major problem itself. Okay? So first of all, it is a bacterial invasion, number one. Okay? So, and once that bacteria gets into the hoof capsule, then it's going to set up shop. And if it can get into the middle part there where there is no oxygen, then that anaerobic bacteria is going to thrive. And for whatever reason, that kind of opens up the door for its buddy there, the fungi, to come in and start digesting that particular area. And their goal is to go toward the coronary band. Okay? Of course, this is a slow, it is a gradual process, all right? It doesn't happen overnight. And a lot of times I'm afraid that we actually don't catch this until we get to the point where we're in trouble. And the horse becomes lame at that point in time. Or our farrier makes the visit and the farrier picks up on it. In fact, the farrier is the one in most cases that's going to pick up on a problem of white line disease. All right? Now, how, and your question was, how does bacteria get into this hoof capsule? All right?
Absolutely.
So, and there are many, many ways that can take place. And the first thing that I'd like to talk about are mechanical factors that are going to contribute to the bacteria entering the capsule itself. One is a long toe. In other words, if we don't maintain a regular farrier schedule, we go too long, the toe gets too long. What that does is that actually puts more leverage on the toe part itself, causing some stretching of that white line area, giving us an entry point for the bacteria itself. This is actually a hoof model, and the point is here that we've gone way too long before it was actually trimmed. And let me turn it this way, maybe to kind of give you a different view here. And so the opposite side here, we went ahead and trimmed that. But when your toe gets this long, we're applying more leverage at this point. And if you can actually see this, and maybe you can, it's going to be a whole lot wider here in this particular area. And that means that we've had expansion, we've had stretching there, and we've got a weakened point there, and that becomes a direct point for bacteria to get into the hoof capsule itself. We can have a horse that has a club foot. That will contribute to the situation as well. We could have sheared heels. We could have, as we just mentioned, a balance problem as well. So a mechanical issue or a conformation issue or a distortion in the hoof capsule can lead to a white line problem. All right? Now, another thing that's going to lead to a white line problem, or can lead to a white line problem, is the environment. We have wet conditions, we have dry conditions, and then the two companions that we talked about, bacteria and fungi, are ever present.
Mhm.
Okay? Now, in a wet situation, what happens is that hoof capsule wants to soften, and the hoof wall wants to weaken. And a lot of times we will have some pancaking of that foot. We'll actually have some stretching of the white line again, and once again, an entry point for bacteria as well. Now, we often associate white line disease with excess moisture, but that's really not the case. Okay, we can be in a very dry, arid area where we need moisture. And so what that hoof capsule does at that point in time is it wants to do the opposite. It wants to contract. And as it contracts, then we can end up with some cracks. We can end up with chipping. Once again, entry point for bacteria into the hoof capsule itself. So the environment comes into play as a reason or a contributing factor of getting bacteria into the capsule. I'm sure that most of you, if you've owned a horse, you've had a problem with an abscess, and you've had to deal with an abscess. Well, number one, that tells me that we've got maybe some hoof quality issues to begin with that may have created the abscess. So if we've got an abscess, then we had a point for bacteria to begin with, and then of course after that abscess ruptures, then we have a direct entry back into the hoof capsule as well.
Absolutely.
Something that we don't think about a lot of times, but with the horses that are actually shod, we actually have old nail holes. And when that shoe is reset there, those old nail holes become a direct entry point right in underneath the hoof wall itself. Okay? Laminitis. And we talked about this earlier. If we have a case of chronic laminitis, a lot of times we have the wall separation there, we have the prolapsed heel, we have the hoof wall that wants to turn up in the front. In a lot of our severe cases, direct entry point for white line bacteria. And a lot of times chronic laminitis and white line will kind of go hand in hand. In fact, sometimes we will actually mistake a case of laminitis when it's actually white line disease. Okay, they go hand in hand. And of course, anytime we have a crack, a chip, crumbling hoof wall, entry point for bacteria into the hoof capsule itself. The other point that I'd like to bring up, and we'll spend just a few minutes on this, and that's nutrition. And what nutrition does to help improve hoof quality overall. And so nutrition involves, number one, feeding a balanced diet to the horse. And we always want to feed a balanced diet to the horse. All right? That's our goal there. Now, sometimes if we have a horse that we're feeding a balanced diet to, may still need a little help additionally if they still have a hoof issue. And so at that point in time, we can add a hoof supplement to the mix specifically for the improvement of dermal tissue or the hoof, skin, and hair coat as well. All right?
Absolutely.
So a balanced diet is what we're after, number one. And I'm going to give you some examples here where we have an imbalance and what an imbalance will actually do to the hoof capsule, how it's going to compromise that hoof capsule. And any time that we have a compromised hoof capsule, then I think we're trying to get this point across that bacteria has a direct entry point at that point in
Absolutely.
time. Okay.
It's like a castle wall, right? You know, that wall is broken. The things you want to keep out come in.
That's right. And as you can see here, we have a pretty nasty hoof capsule. And you see the ridges, you see the crustiness there that's going on. And all that was created from nutrition. It was from an improper, an excess of selenium that was being fed to this horse. And so this is a prime example when we overdo selenium. And typically, essentially what we're shooting for is somewhere in the neighborhood of about 5 milligrams per day, which is very minimal, but the horse still needs that. Of course, if you're in an area that is selenium deficient, then a lot of times selenium is going to be added to the feeds that you're providing. If the hay that you're feeding is coming in from a different part of the U.S. or a different part of the world, wherever you may be, then it may be in high in selenium as well.
Mm-hmm.
So there's many factors that go into coming up with this total amount of selenium that horse is consuming on a daily basis as well. So this is one example of excess selenium itself. And what is happening here, the excess selenium actually replaces the sulfur that's needed by the foot of the horse itself. And that just gives structure to the foot. And of course, as you could see in that selenium deficient hoof, that it is severely compromised. Now, another example that we'll take a look at, and this is simply a case where we were feeding excess bran. And that could be wheat bran, that could be rice bran, that could be oat bran.
Absolutely.
Any of those there. And bran is just simply a byproduct of the grain.
You know, and this right here, you know, as you were talking about, as far as, you know, the kind of hoof wall having openings and so on, this picture is a perfect representation.
Right.
I mean, you can just see from that picture how easy it would be for bacteria and so on to penetrate that
You
hoof.
can see the crumbling hoof horn there.
Absolutely.
Direct entry point for bacteria. Okay. And so what bran has that a horse does not need is phytates. And phytates are extremely high in phosphorus. And so what we're doing is we're getting our calcium-phosphorus ratio out of balance. And when we get too much phosphorus in the diet of the horse, then that ties up the needed calcium. It doesn't allow the horse to absorb it. And of course, the calcium, if we want to look at it this way, is the glue that actually holds that hoof capsule together.
Mm-hmm.
So if we lose the glue, then the foot starts falling apart, just like we were looking at there.
Absolutely.
All right, that's another example of an imbalanced diet, okay? And of course, if you look closely here, you've got all kind of issues at the end of the hoof wall there. And it actually looks like we've got finger-like projections that are growing out of the end of the hoof wall. And this is created from a vitamin A, either a deficiency or an excess. And in most cases, it's created from an excess simply because we provide too much vitamin A to the horse itself. And of course, this one is a little funny. You get the same clinical signs whether you have too much or not enough of vitamin A, okay?
Mm-hmm.
And of course, that's just a direct entry point for bacteria once again. Another problem that we can get into can come about from too much methionine in the diet of the horse. Most of what we feed, as far as a complete feed, is going to have methionine in it.
Mm-hmm.
If we're feeding 2 or 3 supplements to the horse, then you can almost bet that every one of those are going to have methionine in them as well.
Mm-hmm.
Okay?
Absolutely.
So, how does that affect the hoof and hoof quality? Where we have too much methionine, then it actually mimics white line disease, where we have wall separation, just like white line disease. But it wasn't caused from bacteria and fungi. It was because of an excess of methionine in the diet of the horse. All right. Zinc. If we have a zinc deficiency in the horse, and this is kind of an odd one here, with a zinc deficiency, we have extreme hoof growth, fast hoof growth, and hoof growth to the point where it needs to be trimmed every 10 to 14 days with a zinc deficiency. Of course, if you can imagine, when you have that quick a hoof growth, it's very poor quality. It's going to want to break and chip very easy. Once again, direct entry point for bacteria into the hoof wall itself.
Absolutely.
Okay.
You know, the one thing that I've kind of have witnessed or seen through, especially you talking here, is that when we're talking about nutrition with the horse and an imbalance, you know, you might just automatically assume that they're not getting something, but it could be that they're getting too much. So just, you know, throwing everything in the kitchen sink into their diet is not the way to go. And it's really finding that balance, right? Finding
balanced diet.
Absolutely.
And providing that horse with what it needs on a daily basis and in the right proportion and ratio to each other, so that one doesn't interfere with the absorption of another one. Let's talk about some clinical signs, some symptoms that we're going to see, say at the beginning of a white line problem. But anyway, you see all this crumbling that's going on here at the end of the hoof wall. You see all this black that's going on here. That's bacteria that's working on the foot of the horse. And if I flip this over right here, maybe you can see this, but we actually have some wall separation here in the toe that we can actually stick a hoof nail into to a certain point there. If you look back here in the heels, you can actually see the separation that's going on there. And basically this is the start of some white line disease there. That's just a direct entry point for bacteria to get in, set up shop, and then try to progress toward the coronary band then. So that's one thing that we need to be mindful of. If we got anything going on like this, we got separation, then that is a definite giveaway itself. A lot of times where we have a soft hoof capsule, that white line is going to be stretched. It becomes wider, in other words, and especially in the toe area. And if that is the case, then you know you need to be on alert at that point in time. We don't want that to get out of hand as well. And we have a product specifically to help you with wet and dry conditions, plus fight off the bacteria that's present as well. Another thing is if we actually have a case of white line itself, and we don't really have, well, we have a start of white line right here in the back of the heel. We actually have separation at this point right here, and we have separation on into the quarter here as well. But a lot of times with the beginning of white line, we're going to have kind of a gray or a powdery substance that we're going to find, kind of a chalky substance, at the beginning of a case of white line disease as well.
Now, Mike, if, like, say, for example, a horse owner picks up the hoof and they are going to clean out those areas, how would you suggest the best way to do that?
Well, where we have a horse that's barefoot, a dental tool works great. A horseshoe nails works great. Where we're going to come in here and we're just going to clean that area out as deep as we can get it.
And how about those old nail holes? Just
old
the same
nail
thing?
holes are the same way. Of course, after the shoe has been reset, then we can take the clay and pack here. Let me just do a little demonstration right here.
Yep.
This is actually the clay. It's a very soft, putty-like product, very tacky. And say where we have the wall separation that started here, let's go in and clean that out as good as we can. And then we can take the clay and then we're just going to pack it and fill that void.
Absolutely. Now that is designed to stay in place. How many times a week do you think they would?
Under normal conditions, we should have enough residual left there for like 3 or 4 days.
Okay.
We'll come back, we'll clean that out, and we'll repack that. And what that's doing is that's holding the active ingredients in place, which is tea tree oil and tame iodine. It's going to kill any bacteria that would be present, and then it's going to keep anything from re-entering that point as well.
Now, if you are in a wet environment, you may have to apply it, a little bit sooner. But as we said, picking up those feet every single day will kind
Sure.
of help you determine how many times you need to do it and whatnot.
Another clinical sign or something that we're going to see with a white line problem is that the hoof wall may become dished.
Mm-hmm.
And of course, anytime that happens, that's going to stretch the white line area there. Another thing that we often hear too is my horse won't hold a shoe between resets. And so if you got some issues underneath the hoof wall, then you essentially don't have a whole lot to nail to.
Mm-hmm.
And that horse more than likely is going to pull a shoe at some point before that farrier is scheduled to return to do the reset then. Worst case scenarios, we're going to end up with lameness.
Mm-hmm.
And when we have a lameness issue, that means that the problem has progressed severely.
Mm-hmm.
We have quite a bit of wall separation that's going on there. And that's actually causing some lameness issues at that point in time. And of course, as I mentioned earlier, in severe cases, white line disease can actually mimic a case of laminitis.
Mm-hmm.
And a lot of times the only way that we will distinguish the difference between is it a white line disease or is it laminitis, and that's through radiographs. And that's where a vet comes into play. And through those x-rays, a determination can be made, and then the proper treatment protocol put into place for whatever the case may be at that point.
Absolutely. Okay, well, Mike, we've talked about the causes. We've talked about, some of the signs.
Mm-hmm.
We've talked about several things. But as far as these people watching today, what do you recommend as far as the treatment method?
Okay, there's several things that we need to entertain when it comes to treatment. All right, the first thing that I would throw out there is to prevent the problem to begin with. Okay,
Mm-hmm.
prevention is the key.
Absolutely.
Okay, now
A lot easier to prevent a problem than it is to fix a problem.
if we do end up with some wall separation and some white line disease, we need to correct whatever caused the problem to begin with. If it was a long toe, then we need to correct our farrier schedule. We need to maintain a regular farrier schedule to prevent that from happening there. If it's some form of a hoof wall distortion that can be corrected that caused the white line problem, then we need to correct that. So if we'll correct these issues in advance, then hopefully once we resolve the issue, then it's not going to return at that point, okay? We've mentioned this, and this falls on the shoulder of the farriers. That foot has to be balanced, okay? In extreme cases, we're going to have to do a hoof wall resection, okay? That's going to involve your veterinarian. It's going to involve your farrier as well. In a hoof walls resection, what they're doing is they're removing this old hoof wall where there's nothing underneath it, and they're taking that back to good tissue, and then what they're doing is they're exposing that to the air itself. And of course, if you remember from the get-go, the type of bacteria is anaerobic. And so that's why we want to do this in extreme cases like this right here, okay?
Mm-hmm.
And we hope that you never have to get to this point and have to do that, because that's pretty ugly.
Yeah.
Okay?
Yeah.
Now, that is the treatment protocol in those cases like that, okay? And of course, anytime we have to do a resect, then we need to follow the advice of our veterinarian and a farrier, whatever they tell you to do then. And of course, anytime we have to do a resection like this, it's going to increase the frequency of the farrier visits as well. In fact, that farrier may have to come out every 2 weeks to keep an eye on this. And then once again, it falls directly back on the shoulders of the horse owner to keep this area clean and to keep that area dry as well, okay?
And also promote that hoof health.
That's right. In fact, that's exactly right. In fact, that was my next point there.
I stole it from you.
You stole it from me. And it's up to the horse owner to provide that horse with nutritional support to regrow what's been debrided then, okay? And of course, in a situation that you're looking there at this particular hoof wall, of course, you got the front of the hoof wall that's involved. You actually got part of the quarter that's been resected in this situation. You're looking at probably a year to completely regrow this foot back out, to grow the old problem foot out and then replace it with a new sound foot. And that's where nutritional support comes into play. And then let me spend just a minute talking about one option that you have as far as a hoof supplement. And that's actually Farrier's formula. The green bag is our double strength version. That's going to be a 60-day supply for a 1,000-pound horse at a half a cup or 3 ounces per day. It takes about 2-3 months to actually start this new hoof growth that you'll actually see at the coronary band, and then another 7, 8, 9 months to completely regrow the old foot out.
Absolutely.
And of course, it's doing that internally, and that's what we're after there. It's this internal growth. And as it grows that foot out, it's going to strengthen the internal part of the foot. It's going to thicken and strengthen the hoof wall. It's going to thicken the sole of the foot. And as it reaches completion, it's going to give us a good, tight sole hoof wall junction there.
Absolutely.
And so if we can end up with a good, healthy, sound foot, hopefully we won't ever have another case of white line disease and have to do a resec that we just took a look at there.
And for any of our anyone watching in Europe, this might be known as Farrier's formula double concentrate. Or just, of course, there's also just Farrier's formula as well. And so, of course, here in the States, it's known as Farrier's formula double strength. And then we also have the double strength plus joint for those horse owners who may also not only have a white line disease problem or a hoof problem, but a joint problem. That's going to deliver the same nutrients as the Farrier's formula double strength, just with the additional support for joint health. Move those back.
And then something else that we can do as well, I think Farrier's finish comes into play as well. It's a very mild, it's a conditioner antimicrobial, so it's going to help fight off any bacteria that would want to eat on the foot itself.
Is this one open here?
No, but this one is here. But
well, the other good thing about the Farrier's finish is that it is non-caustic, right? So I can put that on my hands. That's kind of our number one rule when it comes to chemical, or it comes to topicals, is stay away from the caustic stuff. The stuff that burns, the stuff that can basically damage the proteins of the hoof.
And where you've done a resec like this, you've got some very sensitive tissue there.
Absolutely.
And so you really don't need to apply a caustic material that's going to burn and kill that good tissue. In fact, a caustic material will actually slow down hoof growth, and that's not what we want if we've had a resec.
Absolutely.
We want some hoof growth there.
Absolutely.
And plus, we want some good quality hoof growth in the process as well.
And the other thing to kind of consider, of course, is when you're looking at topicals, we know there's several different remedies and so on out there. But using something that such as Farrier's finish, there's ingredients in there that are not only going to kill the bacteria, but as Mike mentioned, it's going to help with the moisture, and it's going to do more than just kill that bacteria. It's going to support that hoof environmentally, keeping that moisture away, of course, killing the bacteria, and so on. But yeah, that's the number one. If you can't put it on your own skin, don't put it on. Don't put it on your horse.
Stay away from it, right? And if you have a white line issue, then you talk to your farrier, talk to your veterinarian, follow their advice, do what they tell you to do. So one of the best things that we can do when it comes to white line is, number one, detect it early. Head it off. Okay. If we let it get out of hand, then we need to call in our farrier or veterinarian, take their advice. If we have to do a resect, then follow their instructions and what you need to do there. Okay.